Hello, welcome to Doc Talk Live. I'm Dr. Brad Goodman. This is Doc Talk Live, and today I have with me Kathy Oubre with Pontchartrain Cancer Center. Did I pronounce all that right?
You did. Yes.
Oh, good, good. So, Kathy works at a facility that provides services to people with cancer. And obviously, we are remote broadcasting, which is certainly becoming more of a thing due to COVID and social distancing, and that's a great segue into really. I'm curious. I'm in an orthopedic clinic. I deal with people with various degrees of injuries, and you're in a cancer clinic, and I could speak at length, and maybe I will, about how COVID has affected us, but I'm curious how COVID has affected you, your clinic, your staff, and most importantly, your patients.
Yeah, we could talk about that for a while. It's a brave new world out here, and we're figuring it out every day, and it's changing daily.
Yeah,
No doubt.
that's the amazing piece of all this is that is that things change moment to moment, as I've said
Hmm.
on other shows.
Right.
Um, and so tell me a little bit about um, uh, where you guys are at and some of the changes y'all have made.
Okay. So we started writing our COVID policies and procedures for patients and staff maybe about 2 weeks ago, and we've revised them twice since then. And this past Sunday at 8 o'clock, we had another emergency meeting. Tore up the ones from the week before and had to totally rewrite them and, implement new changes on Monday as the cases in Louisiana continue to rise, and we have to address it.
And I imagine your patient population is much more fragile than my
Hmm.
patient population.
Right.
Not that the way you would handle them would be any different than the way we would handle them,
Hmm.
but but certainly I think the stakes are probably a lot higher um, in with a cancer patient, and I only know what I read about the virus,
Hmm.
and um, what I've read or what I gather is patients that are elderly or immunosuppressed, meaning their
Right.
immune system is not that strong. They're at greater risk of
Hmm.
mortality than a
Correct.
young healthy person.
Hmm.
And so maybe we should focus on this bit about immunosuppressed
Okay.
and 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 tell our listeners, our viewers, what immunosuppression means, and really how you deal with that situation, frankly.
Yeah. So as far, in regards to what immunosuppression is, that's probably best coming from you rather than me. I'm the operations gal. So I take
Okay.
what, the physicians and the clinicians tell me, and then it's my job to design policies and procedures around it for safety.
Uh,
Now,
so let's
so
work backwards into this then. Let's work
okay.
backwards. Tell me what policies and procedures, if any, you would have with uh, different severities of illness, or maybe not,
Sure.
in your patient population.
Sure. So, the policies and procedures that we put in place on Monday, so just, 5 days ago, we've closed all of our waiting rooms. So if you have a clinic visit within our practices, you're asked to wait in your car until your appointment time. The medical assistant will then go outside and get you, and you're immediately brought back for triage. Now, I will preface that with a couple of things. The day before, anybody's appointment, if they're coming into the clinic. We have a pre-visit checklist now, which the medical assistant goes over with that patient and if they are bringing a caregiver with them. So, it's 4 questions. In the last 14 days, have you had fever, shortness of breath, traveled to any of the hot spots that, known hot spots, or been in contact with anyone who is either suspected or tested positive for COVID?
Or live near
If
New Orleans.
I'm sorry? Yeah,
Or live near New Orleans, right?
exactly. Yeah,
That would
fortunately,
be a
we
risk
have that.
factor now.
It's a
I would,
problem. Yeah.
yeah, okay. And so if
Um,
I answer yes to any of the questions,
mhm.
what then happens?
It flags to one of our nurse practitioners, who
Hmm.
then in turn calls that patient back and has just a little bit more of an in-depth discussion based on what we know about that patient. For example, a lot of patients going through chemotherapy have reduced white cell counts anyway. So they might have, what we call a neutropenic fever. And so it wouldn't be related to the COVID, it might be related to their actual chemotherapy. So the
And
last thing we want
fever,
to I'm
fever,
sorry.
I should say, medically, fever appears to be one of the uh, cardinal symptoms of
Mhm.
COVID. That's why that's
Correct,
important. Just trying to let our
correct.
listeners know.
Yeah, and, the cough is kind of an interesting thing right now because it's also, cold season, and
Yeah,
in
and
Southeast
allergy
Louisiana,
season.
it's allergy season here, and that's been really difficult. I mean, you even remotely cough in this area, and people look at you funny.
So,
But we have to
so
assess that.
me, I missed that. Say that again, Kathy.
Well, it's in addition to it being COVID, it's also just cold season, and it's allergy season in Louisiana. Everything's blooming.
So, I imagine, and I'm finding this with my platform on Doc Talk Live, I
Mhm,
imagine many of your patients are quite well versed in COVID. And this may not be a question that you really can answer directly, or maybe not, but I'm
mhm,
curious, because certain medicines, like chloroquine, which is for arthritis, a type of
okay.
rheumatoid arthritis, and also an antibiotic, azithromycin,
Mhm,
may have some um, usefulness for
mhm,
COVID. Um, and in at least here in Alabama, there's some concern about definitely shortages of the chloroquine.
mhm,
Um, but your patients are so fragile, or can be so fragile, um, they may want to have that medication uh, in case they start feeling symptoms that may
right,
be relatable to COVID,
mhm,
especially in the absence of good testing yet.
mhm. So, I'm sorry, you broke up a little bit. Ask what's that question again?
Well, my question is how are your physicians handling uh, the requests for medications which are potentially in short supply, but your patients seem to me intellectually to be more at risk than, let's say, my patients in an
Mhm.
orthopedic practice.
So, we are not experiencing any drug shortages as of today.
Okay.
W
Do you know
we
if your
don't think
patients are requesting medications uh, other than other than what they would typically request?
so we met about that yesterday, and we don't seem to be having that issue. Our only issue right now is our critical shortage of PPE.
So tell our viewers what PPE stands for. Personal
Oh, goodness.
protective
Equipment. Yes. Thank
equipment.
you.
So we're talking about these masks,
And gloves.
um, and gloves, and things
Mhm.
like that.
Yes, and face
And so,
shields and things like that.
how are you dealing with those shortages?
So we're critical right now, but we're not without. We have about another 5 days worth of PPE. So that was actually a part of my afternoon today, was talking to various suppliers as well as checking out Amazon. So our primary supplier anticipates a shipment in on Tuesday, and they usually 24-hour ship to us. So we
Do
should be
you
okay.
do you use the N95 mask or do you use just a regular mask?
We primarily use regular surgical masks, but every clinician, including our nurses, do have an N95 available to them.
Okay. Um, what about telehealth? Have you guys switched to telehealth and um, do you guys do home infusions or how does all that work?
Okay. All of our infusions are done in the clinic. We did start, so telemedicine, that waiver came out at 3 o'clock on this past Wednesday, not 2 days ago, but a week ago. On Friday afternoon, we had our policies and procedures and all of the IT equipment in place, and we started on Monday morning. And as of today, it accounted for 40% of our clinic visits this week. So a large
Wow,
percentage. Yeah, it was a huge
wow.
uptake.
Had a
Now,
rapid transition into
yes.
telehealth.
Mhm.
Interesting. Do you think that will, once this passes, do you think that will continue?
So a couple of things on that. The way the waiver is designed with CMS is it is part of an emergency waiver that allows us to do FaceTime, Zoom, and DoxyMe in a non-rural setting. That's the only reason practices are able to get telehealth moving so quickly. Because the way telehealth was originally designed is you had to be in a rural setting and the patient had to go to another rural health provider. They couldn't do it from home.
Yeah, but I don't, 6 months from now, I don't want to travel to Pontchartrain Clinic in New Orleans, but I want to see your providers
Mhm.
and I'll email you my information. Why do I need to have a face to face if I can have a face to face? So
Um,
I'm not talking about policy now. I'm talking
okay.
about practically speaking. Do you think that telehealth is here to stay? Well, that is a policy question.
It is a
Answer
policy, but I can answer it.
both perspectives.
Well, I can answer the policy question. So there is discussion within CMS already to revise telehealth, to remove the rural health component after the COVID emergency is over.
Okay.
So I do know that that's happening within CMS. So we'll see. I'm hopeful because some of our patients do drive an hour or two to see us for a routine 3-month follow-up. That's a hardship. We would like to remove that hardship from healthcare.
Yeah. Okay,
Yeah.
absolutely.
Mhm.
What about screening? I mean, patients may have delayed screening for a while, and just because patients do that, and now
Mhm.
they're sort of in a situation where they may not be able to screen quite as easily.
Right.
How has that impacted people that need, let's say, a mammogram or
Mhm.
other screening tests for cancer?
So we're seeing that become a problem even just this week as a result of the COVID emergency. We have two of our hospitals have really cut down on any type of screenings. They used to offer them 5 days a week. Now they're offering them 1 day a week during limited hours. Sometimes that's causing a hardship. So we are seeing a delay in our ability to even just be able to obtain routine screenings for our patients.
And I guess that might set the problem with, you're in a oncology practice, right?
Mhm. Mhm.
Um, and you provide infusions, correct?
Correct.
And these infusions could be done in a hospital, I would imagine.
Hmm.
But because you're able to provide them inside, it's probably a safer environment because the patients are avoiding the hospital,
Correct. Uh-huh.
correct?
Yes.
But imagine you don't have the diagnostic equipment like a mammogram machine or an MRI
Hmm.
machine to provide those services.
Right.
And so that's the challenge because these services are only available primarily in a hospital setting.
Diagnostic material, screening devices, yes, primarily.
Yeah, right. So perhaps there needs to be more options in an outpatient setting for that. No one's ever really sort of thought of that or thought that through. Do you see what I'm saying?
Well, there are plenty of cancer centers that are, even considered moderate size that own all of their own diagnostic equipment.
Oh, I didn't know that. Okay.
Hmm.
So,
Hmm.
so those centers may be more able to continue with diagnostic services
Yes,
um, that a hospital would ordinarily provide.
correct.
And then finally, and you may have questions for me, but finally, I want to talk about the stress
Okay.
of all this to both patients and staff. And
Hmm.
I don't know the answer to this, but I have found this to be quite stressful in terms of um, things change so rapidly. You mentioned changing your policy already 2 or 3 times in a brief period.
Hmm.
Um, um, I have patients that require various procedures, and we put them on the schedule, take them off the schedule, put them back on the
Right.
schedule,
Yeah.
take them off the schedule. And so I'm curious how you, if at all, how you manage the stress for your patients, for you, for your staff, for your
Hmm.
doctors.
Yeah.
Any insights or lack thereof would be appreciated. Insights
Okay.
appreciated because maybe I'll use them, and lack thereof
You're right.
because I'll feel like
Yeah.
somebody's that I'm commiserating with somebody.
No, it's true. So, I mean, mental health is important, even on a good day. And it's something, as a society, we don't address enough, even on a good day. It's more important now than ever. Um, so we've done a few things. We put gene days in place. We don't have pharma rep lunches anymore. So we are bringing in lunch for all of our staff at both locations twice a week. Smoothie days, we bring in smoothies for lunch or as a snack. And then there's other kind of fun things. There's a great meditation app called Calm, which I've been using for years. But for the next 90 days during the COVID crisis, they're offering it free to everyone in the US. All you have to do is download it from the App Store. So I
Hmm.
sent something out to all of our, staff, and we even put it on the website. We put it on our Facebook page to share with our patients that they need to do that. It's available to them.
I think I
We
downloaded
also
that app before, but I'm not very
right.
good at meditating.
I'm not either. I'm not either. My brain runs too fast, but I did it for like a minute, just baby steps. Today I'm up to
Right.
3 minutes. But seriously, I mean, I felt really good after. So, anyways, give it a shot. Yeah, I'm encouraging everyone to take walks during their lunch break, just a quick lap around the campus. We've been, we do have COVID right now, but we've also have really good weather in Southeast Louisiana right now. I mean, it's been in the 80s during the day and sunny, and get outside, hear the birds, breathe in, just do that, because the minute we get home in the evenings, I mean, it's our night job. We move from our day job to our night job. So take
Hmm.
those few minutes, while you're at work, and with my blessing, go do that. It's important. What else are we doing? We gave all of our employees 25 additional hours of PTO, paid time off, because we knew that things like healthcare, I'm sorry. Oh, why am I stumbling on this? Childcare. All of our schools closed. So, and daycares are closing now. So we wanted to be able to provide some support in a way that we could to help our employees deal with these additional issues. I mean, I've got all three of my kids have moved back home and we're all doing virtual school now. And, in addition to my day job, I'm a tutor now for social studies, science, and all sorts of fun stuff. I mean, it's different.
So you're now you got your job and you're homeschooling.
Yeah, absolutely. See, we wanted to be able to provide our employees with that a little bit of cushion to help them if they needed to leave an hour or two early in a day to run to the grocery store and go home and deal with, their second job of now homeschooling kids.
So are
What
you
else
off
are we
this
doing?
weekend? You off this weekend?
No, I have my laptop with me and I have, my to-do list. We are doing things. I'm going for a hike this weekend. After our call is finished, I'm going to go on a bike ride. So,
Awesome.
yeah, I mean, but we all need those things. Louisiana actually has a lot of great day hikes that I was unaware of. I published the list for everyone and sent it to all my staff. I have three of them who are going this weekend.
Well, just stay away from them.
Well,
Make
that's
sure you
true.
make sure you be disciplined.
Social
Well, Kathy, I'm
distancing.
going to let you get on your bike ride. I want to thank you for doing this.
Okay.
I don't know if you get to see some of the comments. We got one comment that we keep cutting off, so there might be some internet issues.
Okay.
I know things have been pretty smooth on my end from what I've seen.
Yeah.
So hopefully folks can find this, and I know Christy will put your information up on the page, and hopefully you
Yeah.
can share it as well with your folks. But thank you for taking the time this afternoon to chat with me.
Oh, thank you. I appreciate it. Take care. Have a good weekend.
You too.
All right. Bye-bye.